People with this and this will have one thing in common: overproduction of collagen. Now, collagen forms part of the skin structure and it's a very essential protein. In case you have a skin injury, so production of collagen will form part of the skin healing process. And in case there was an overproduction of that collagen, what will form will be a huge scar, a big scar called a keloid. Now, this keloid will be of varying degree depending on how severe the scar was. Now, people with this condition, like for example, when you go to a barber shop, you get a clean shave. What will happen is hair, when it's trying to penetrate through the skin to come back on the surface, it might create some injuries. Again, in the hair follicles, you might get some bacterial infection, and still they are creating trauma in your skin. And when the skin is healing, it's going to produce that collagen, and because of overproduction, you're going to have those. Now, we also even have people like who might go for surgery, and in case maybe the condition is not known, they might end up having that same scar. The ear, the same thing. You go get a piercing on your ear, and because of overproduction of that collagen, you get that keloid again. Treatment for this condition may be slightly hard because the cause is not actually known yet. But you have measures you can take, like minimizing the injuries on your skin. Like for example, instead of having a clean shaven head, you can go ahead and have like a hair trim. We have other methods which are a little bit more advanced, like using corticosteroids injections in case maybe you are going for a theater or something. Maybe you are anticipating a skin injury. Having like pressure dressings in case you already have those keloids. We have silicone gel strips or sheets that are usually placed in a place where you have that injury to minimize that formation of keloids. You have laser removal, you have razor therapy, you use a laser to remove those keloids which are already there, or you can use cryotherapy method, whereby you use liquid nitrogen or extremely low temperature to freeze off that part of the tissue, and then it will just be removed. And we have surgical removal.